If you're pregnant or in the postpartum period, having a blood pressure monitor at home could save your life. Hi, I'm Dr. Veronica Gillispie-Bell, and I'm a board certified OBGYN. I have been recommending remote blood pressure monitoring for my patients for years. During pregnancy and in the postpartum period, you're at increased risk for hypertensive disorders such as preeclampsia. When you monitor your blood pressures at home, we can detect those changes early so that we can intervene, sometimes before you even have symptoms. Here's an example of a remote blood pressure monitor. So I'm going to show you how to use it. So you should see an arrow like this one on your blood pressure monitor. You want that to be right above this part of your arm. You want to slide it over your arm. You'll know that you'll have it in the right direction because this tube should be going towards your hand. You want to make sure the cuff is tight around your arm, not too tight, but it needs to feel secure. Now, for your position, you should take your blood pressure about 5 minutes after you've been resting. Make sure that your legs are not crossed, and you want to make sure that your arm is resting at a right angle. Press the button on the blood pressure monitor. You'll start to see some numbers appear. For that top number, we want it to be less than 140. We get really concerned if that number is all the way to 160. For the bottom number, we want it to be under 90. We get really concerned if it's above 110. If you take your blood pressure and that top number is greater than 140 or the bottom number is greater than 90, you should rest for 15 minutes and take your blood pressure again. If your blood pressure is still elevated, you should contact your provider and you may need to go to the hospital for evaluation. Blood pressure cuffs are a small tool that can make a big impact. They allow you to take control of your health and they can save your life.